Hello, I'm Joe Crowley and today I've come to Lowestoft Fire Station to meet the firefighters here to talk about a disease that affects 2,300 men each year in the UK. And it's not something we like to talk about, to be honest. It's testicular cancer. Now these guys are great at saving other people's lives, but what happens when it comes to saving their own? Let's find out. And here we have four of the firefighters who bravely lined up to answer a few questions. Guys, first one is a personal one. How often do you check yourselves?
Hardly at all, to be honest.
Really? How often?
Once a month.
Once a month, okay.
It's written on the calendar.
Written on the calendar. Gosh, you're an organised bunch. I like that. It doesn't feel like men have got to the position where we can talk about it as openly as women talk about breast cancer. Do you think that's right?
No, I don't think so. I think everything's taken quite jovially or light-hearted. There's a joke, it's passed off, and then you kind of carry on with what you were doing, to be honest.
And I think men are still that bit more reluctant to go to a GP, to cause a fuss, to make something of a lump or a bump, really.
Yeah, it's a scary area for a man.
So Ben, tell us about your story.
When I made an appointment to see a GP, I actually made an appointment for a backache.
Oh really?
Yeah, which it wasn't. That was just to get an appointment, and that was with the nurse. And then I kind of had to explain to the nurse what the issue was, which wasn't backache. That was a bit of a swelling, a bit of a lump. And she said, I think you really need to see the GP. He did about 3 blood tests. If he phoned me up a couple of days later to say he'd had the results of 2 of those blood tests and that they were absolutely fine. The 3rd blood test was this alpha-fetoprotein, which I'd never heard of. He said, I'm still waiting for the results of that. He said that's quite a crucial one. And that was the first kind of inclination that it was possibly linked to testicular cancer.
You've had treatment. Mm-hmm. How are you?
To be honest, I do feel absolutely fine now. It's a bit of a scary thing to be told initially. But I think, hopefully the colleagues will agree with me, I've been fairly sort of upbeat about the whole thing the whole way through.
So all clear now?
Yes, all good so far.
Amazing, great to see you back at work and doing so well. And it's time now to hear from a few other stories from survivors and their families.
I first found a lump, it's a couple of days after my 28th birthday actually, and it was purely by chance. I never sort of really regularly checked myself. But I noticed sort of one evening in bed, I sort of rolled over and felt a little bit of discomfort. I checked myself and found a very, very small lump.
I wasn't even with him at the time when he was at the hospital. He'd only told me about 3 weeks before he'd got the appointment that he'd been to the doctors.
You always associate cancer with being sort of an older person's problem. So it really wasn't on my radar at all.
Testicular cancer is cancer of the testicles. It's very important because it's the most common cancer in young men, so it's important to think about for people's awareness. And there are 2 main types. There's a non-seminoma, which tends to happen in younger patients, and by younger I mean often 19 to 25, and the seminoma tends to happen in slightly older population of men.
I was first told at the RAF hospital at Halton. The oncologist there told me that the diagnosis was positive and it was a cancer. Between my first diagnosis and the second time I had testicular cancer was about 20 years. When I found the lump for the second time, it was a feeling of, here we go again. But I knew what to expect.
My journey with testicular cancer started the day before my 31st birthday. I had some friends around for a barbecue, and I'd previously felt a lump during the week that I then had time to talk to my wife about.
I was trying to be calm, really, because it's quite frightening straight away when someone says something like that. For, I think, a young bloke to admit that, I was, a bit worried for him.
Well, more of those personal stories later, but first, we recently followed local testicular cancer charity It's on the Ball to the University of East Anglia to see them raise awareness among students, including teaching them how to check themselves.
I don't think I actually do know that much about testicular cancer.
Yeah.
So good to find out what it actually feels like.
You feel them quite gently, just proper, and you'll be able to feel the normal tubes and things that are in there, but you should feel a lump as well.
That is weird. Yeah, it's a lot more solid than I expected. Like, I was expecting something more squeaky, but it was actually surprisingly solid. It was like, whoa.
A little bit of embarrassment there, a few giggles, but great to see so many young people being made aware of the disease. But now we've moved inside, and it's the firemen's turn to be educated by Vince.
Thanks for coming along today, guys. What I'm going to do is just show you a short presentation. What are the testicles and what do they do? I think most guys, they know that it produces sperm, but I think the main or the more important function of the testicles is producing testosterone. Gives you your manliness, as it were. It also helps control things like heart rate as well, so it's a very important hormone for males to be producing. It's the most common form of cancer in young men. It's about 60 deaths a year from testicular cancer. A cure rate of over 98%, that is the good stat. It's one of the most easily treatable cancers. The cancer itself, the cells respond to treatment very well. So we just have a small set of testicles, might be small, don't know. You might think they are. And the idea is when you've had a bath or a shower, you're sort of rolling around and you're feeling with your thumb and your forefinger. Okay, so what are you looking for? You're just working your way around the testicle. There are those tubes that run up the back and they can feel quite odd sometimes. But if you're doing this on a regular basis, you'll know what's normal for you. You're looking for any abnormalities within the testicles themselves, any odd feelings, a dragging sensation, a heaviness, and in particular, a lump on the surface of the testicles. Okay guys, so you've had a go with the feelies, so I think what might be a good idea now is if you put that knowledge to the test and go off and give yourselves a self-examination and then report back to us later on in the engine room.
Well, while the guys are checking themselves, let's hear a little bit more of the personal stories from Vince and some of our other survivors.
During the hard moments and through treatment, my son had only just been born. He was still a toddler, so I used him as a focus to keep myself going.
Vince had his treatments and I went to work, and at work I didn't talk about it. We just got on with our days, got on with the treatment.
One of the reasons it's very important to catch testicular cancer early is often the treatment is simply surgery and then following the patients up routinely in clinic and not actually needing any more therapy at all.
I suppose the miracle to our story is the fact that we fell pregnant with Annabelle. We'd only just recently that year started to try, and we knew we were running out of time because after chemo you have to wait 6 to 12 months. We spoke to the doctor and we had a tiny window after my operation, but before I started chemo.
Chris got diagnosed on the Monday evening and then got a cancellation appointment on the Thursday. So we were very lucky in that sense that we didn't have the time to sit there and count down days till his operation.
It does affect your daily routine, and obviously your wife is affected as well. They're the ones who sort of do most of the worrying for you because your main focus is just on getting through it. The initial thought is we're not going to be able to have children.
Well, really powerful stuff there, and we'll be catching up again with those guys a little bit later, but now it's time to rejoin our firefighters. So guys, check yourselves, how was it?
Good, everything's nothing different to normal. So.
Good, straightforward, easy, just takes a few moments, right?
Yeah, very, yeah. Although I used to check quite often, I was probably just having a feel rather than doing a proper check, so it's good to learn how to do it properly.
And Steve, you were one of the guys that said at the beginning, no, I don't really do this, I don't really check myself very often. Has today changed that?
Yeah, definitely. Even though with what we've had on station and bits and pieces, it lapses to the back of the mind and you don't really pay attention to it sometimes, so it's highlights. I'm going to have to check more, to be honest.
And Ben, of course, you've had it, you've been through the treatment, but you still have to check as well, don't you?
Yeah, I should do. I'm probably the worst one for not checking. I go to Norfolk, Norwich and have it done every 3 months where they check it for me, but I guess from what we've said today, I need to know what's normal for me, so yeah, I'll definitely be doing it.
But the key thing is you caught it early, and catching it early, it's very, very treatable, which is great news for all guys out there, really. I'm pleased today's had that impact on you, that you understand how important it is and how easy it is as well, so thank you so much for your time. And now it's time to join Chris, Gareth and Vince once more for the final part of their personal stories.
I'd like to say I'm someone that goes to the gym 4 times a week and only eats greens, and I certainly have moved more towards that. I've tried to live a healthier lifestyle, but in this modern world we live in, it's very difficult.
It's got an excellent prognosis, and even when it's spread, as people will be aware from Lance Armstrong, it's extremely curable.
I think I do look at life in a different way. I think people sometimes get hung up on little inconsequential things.
The guys at the hospital make it, make you fully aware that, any issue that you have, you can go back there and get it checked out. I think after the treatment, they recommend that you leave it a year before you start having children.
Chris's sperm count was recovering and improving, but it was still a 15th of where a normal sperm count should be, and we were recommended to have IVF treatment. It was from that we are now expecting our first child in 2 weeks' time. If we would like to have another child, that maybe it will happen naturally the second time, but if not, we've got one little Talford miracle.
It was incredible to hear all those stories from survivors and their families. It certainly made me more aware of testicular cancer. I hope it has for you too, because however rare this disease is, it still affects thousands of lives each year in the UK. And the central message here, and it's so important, is that guys, you must check yourselves regularly. That's what this charity It's on the Ball is saying. That's what I'm saying. It is so important because it's so quick, it's so easy, and yet it could save your life. The firefighters have done it here today, but the big question is, will you do it? I certainly will be.